Well, we were told all the way through we'd be following the science, and therefore every decision that was made would be a wise one. I wonder what Dr. Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter and former public health consultant in communicable disease control, makes of the inquiry so far. Were we following the science?
Well, clearly not, Nigel. And what is concerning is that elephant in the room has still not been addressed, because the questions to ask are, why were you concerned about the hospitals? Well, you were concerned about the hospitals because over the last 13 or so years, you have underinvested in resilience capacity in our hospitals, and now the pandemic has arrived and you're unable to cope. And we repeatedly see, Dominic Cummings, Prime Minister Boris Johnson, Matt Hancock, discussing what I feel is beyond their capabilities, because they're politicians, they're not pandemic experts, and yet they were discussing, should we do this, should we do this, should we do that? I know decisions are political, but they appear to be discussing the science for which they are not qualified.
Interesting, but no, that's a very, very powerful point. Now, look, this inquiry will rumble on. Maybe there'll be some accountability, probably not. But can we, and this is the really important thing that people want to know, can we learn some lessons from this so that if this type of problem comes again, we can handle it that much better?
Well, I hope so, but with respect to learning, unfortunately, we have a propensity to have history repeating itself. And an inquiry that takes so many years, and then the key people have left, moved on, etc., dilutes the effect of an inquiry. For an inquiry to be really good, really effective, lessons learned, it ought to be shorter in time period.
Wide words, Bharat Pankhania. Thank you for giving us that assessment. He was very open, very honest, wasn't he? Well,